All right, so we can, but I'm going to go ahead and admit everybody.
Sounds good.
All right. Hi, everyone. I'm Lynne Timm, and I see we have a few people today. Because of President's Day, we weren't sure um, how many would be able to attend. So thank you for being here. I see we've got Mark and Steve. Um, if you guys have any questions as we go along, if that's okay with you, Letty, we can just have them ask since we've got such a small group. Um, we
Absolutely.
we
Yeah.
may have some more come on in the next few minutes, but I'll just go ahead and let y'all know we have Letty Perez with us today. Letty is our agent, broker, account executive with Pivot Health, and she's been with them forever and is an expert in short-term medical and the products and positioning this product. And she is awesome to work with. So Letty has been such a great resource to all our agents when they have questions about the product or she can direct you, she can usually answer them, and she's just a very valuable person to know. So, um, anyway, so Letty, if you want to get started, what we're going to do today is Letty's going to go over her product training presentation,
Mhm.
and uh, and that should give y'all a lot of great information about Pivot.
Great. Thank you so much, Lynn. I appreciate that. Welcome, everyone. Look forward to working with all of you. Um, we are very excited that you have joined Pivot Select team. So, a little bit of background on who Pivot Health is, just so that you understand. Pivot Health is not actually an insurance company. So we are a product development, marketing, and management company. We launched back in 2015. We actually design products and bring them to market, but we have carriers that insure the plans for us. So I mentioned this, and just keep in mind that when your client purchases a Pivot short term medical plan, they are going to have the carrier name on their ID card. So they don't want to call in or walk into a provider or a facility and say they've got Pivot Health Insurance. Of course, the first reaction is going to be, we've never heard of them. That's because we're not a carrier. So the name of the actual carrier will be clearly stated on their ID card. Again, we launched in 2015. The founders are people I've worked with in the industry over my career. I'm going on 24 years in the individual short-term medical market. So just a little bit of experience. And in 2018, we were acquired by healthcare.com, which is an insure lead tech company. And that's why you'll notice at the end of the presentation, when I share my contact information, my email domain is healthcare.com and not Pivot Health. So just to give you a little idea why you're going to see different names involved. For those of you who are familiar with the short-term medical market, I just wanted to give you a little bit of update. So last summer, the current administration presented potential change to short-term medical duration rulings. Um, they were supposed to make an announcement before the end of 2023 to bring down the durations across the country wherever short-term medical plans are sold down to a maximum of 3 months. They spoke about adding an additional 30 days, giving the client up to 4 months of coverage. And that was supposed to be per carrier. Um, Basically, I've lived through this before with previous administrations that did the same thing. Basically, what they were trying to do is push uh, the ACA or the marketplace enrollment numbers up by giving clients less options, because obviously no one wants to go with a 4 month coverage period, um, and not have and then stay with no benefits. Well, the ruling did not get finalized. Last word we got was at the very end of December. We have lobbyists in Washington, and they were told that there should be some type of a decision made towards the end of Q1, beginning of Q2, um, whether or not they're going to go ahead and move forward with this change. And then, of course, it would take a few months before, or at least 75 days, they said, to enforce the new ruling. So, good news for us is business as usual. Looks like we're clear through Q1. Also, we offer extended duration plans, which are going to be grandfathered in according to the proposal. So anyone who's on an existing short-term medical policy can remain on it and not lose their coverage. And none of the medical underwriting or pre-existing rules would change on these plans either. So two advantages working with Pivot Health. We have two carriers that insure our plans, and they are available in most states, both carriers. Therefore, so if the ruling does come through and you have a client that does need to sign up under the new duration rule, they would be able to go from one carrier to the other and still be in compliance with the state rules. So, and we also offer extended duration, so 3 by 364-day coverage periods, which means that um, they would also be able to have up to 3 years of coverage back to back without having to reapply, and again, still be within the rules of the government for these plans. Couple of things I wanted to go over for those of you who are not familiar with short-term medical plans. What is a short-term medical plan? So this is an individual plan. It is designed for those healthier people because there are limitations and exclusions on the plan, and also there is a simplified underwriting for our short-term medical plans, which means that not everyone is going to qualify. So just a couple of key differences. An ACA plan, of course, has to cover everyone, but of course, the premium is going to be based on whether or not they're going to be eligible for a subsidy or a large enough subsidy to make it affordable, because those plans are very expensive, because it includes everyone. It does not exclude any kind of illnesses or pre-existing conditions, and they have to accept everyone. It is guaranteed issue. The other thing is that with the pivot plans, we have plans that use national networks, but the majority of our plans are open access plans, which means the client can go to any doctor or any facility. The other key difference is for those of you who are familiar with the ACA plans, they are designed to work primarily in the state where the plan is issued. Short-term medical plans can travel with the insured throughout the United States and be utilized, so long as it's issued in the state where the plan is available. And then with ACA plans, of course, you have to enroll during open enrollment, or there's got to be a special life event that will allow you to get enrolled in a plan outside of the open enrollment period. With short-term medical plans, you can sell these plans at any time of the year. So you can do an application today, and the coverage can begin as early as tomorrow. So a lot more flexibility, but again, there are limitations, and these plans are not designed for everyone. Just want to give you a little bit of an idea as you are working with a potential client. Um, you want to say, let's take a look at who would be a good candidate for a short-term medical plan. So I'm going to give you just a couple of different ideas. So when you start talking to someone, it might spark, a little tick in your head and say, okay, this might be a good fit. You've got people that are part-time workers that are not working for a company enough hours in a week to get offered group or employer coverage. You have those people, which is a large population now, what we call the gig workers, right? They go from job to job. They are like contracting out themselves. They're 1099 workers, so they're not going to get offered those employer benefits. You have those early retirees, which is becoming more and more popular, where people are not wanting to wait till they're 65 until they're Medicare eligible to retire. And then a lot of those people, if they're in that healthy age band, and they can afford to retire early, more than likely they're not going to get a great subsidy for an ACA plan uh, during in that age band. It's generally very expensive. You have people that are in between jobs, or they've started a new job, but they have a 90-day waiting period before their benefits will start. That would be a good fit for a short term medical plan, because you can sell a short term medical plan for as little as 30 days of coverage. Then you have those self employeds, again, looking for coverage for themselves or their families. You've got those college students that graduated and are still looking for a job, or let's say they do get a job, and they still have that waiting period. Those families that just can't afford the ACA plans on the marketplace. This is going to be a good option if they're young, healthy families. And then you have those kids that were still on their parents' plans and they've hit that 26-year-old mark and they can no longer be on their parents' health plan. So you can write them a policy on their own. So just to give you a couple of different ideas when you might want to consider offering a short-term medical plan as an option. So when you get contracted with Pivot Health and you log into your agent portal, you're going to find the Pivot Health proprietary product suite. So you're going to have short-term medical plans that are available for a baby as young as 6 months of age, all the way up through the age of 64 and 11 months of age. So right before they turn 65, short-term medical plans are available. And then we have dental and vision product. This is going to be available as a check the box when you're selling a short-term medical plan, or as a standalone product that you can offer to any client. And with our dental and vision, minimum age is going to be 18 years of age, and there is no maximum age with these plans. Now, if you have children under the age of 18, they can have benefits and they can sign up, but they would have to be on with an adult on the plan. Nice thing about the dental and vision, that you can sell it alone. If you happen to be working with Medicare clients and they're in need of dental and vision, you can offer this at any age over 65. Then you have a supplemental product. This is going to be only available as a check the box when selling a short term medical plan. This is a nice bundled product that can be kept on the books until the client turns 65. So I'll be going over some examples and showing you how they can be used. So what makes the Pivot Health short-term medical products? We are very aware, we are up there with as being a fairly new company, but we are in that top 3 short-term medical companies out there. So what makes us different from our competitors? We have a large array of plan options that you're going to see are bound to fit your client's needs and budgets when you go into your quoting portal. Those extended durations, what do I mean by that? 2 by 180 day, 2 by 364 day, 3 by 364 day coverage periods. So essentially, the client is signing up today and they are buying more than one policy back to back without having to do a new application in between each coverage period. Now, of course, this is going to vary by state. And if the current administration makes the changes that they're proposing, then these would be gone once that ruling goes in force. No additional underwriting, so there's no new application in between each coverage period. No new pre-ex look back, no new waiting periods, and all of the benefits, including deductibles, coinsurance, and benefit maximums, all reset with each new policy coverage period. Now, keep in mind the benefit maximum selected on these plans is not a lifetime maximum, it is per coverage period. And anything that develops while they are on this plan, for example, a cancer or something major like a heart attack, if they are on an extended duration plan, we have to continue to cover that condition, and we cannot deem it as a pre-existing and exclude the coverage. So if something major like that were to happen and they're on a plan with $1 million total coverage, let's say year one, they develop a cancer and they go through $500,000 of their maximum benefit from their first term. Second term starts, that $1 million maximum benefit will reset. Of course, they would have to satisfy deductibles and coinsurance for that second term, but they would have that maximum benefit reset as well. Commissions are going to be level for you as an agent, so there's not going to be a reduction in your commission for the second and third terms. And also, for our companion life insurance plans, the premiums are going to be level. So whatever you're quoting them for year one, when you've extended that extended duration, that premium is going to stay level. It'll be the same premium for all three coverage periods. And that's only going to be for our companion life plans. All of our plans are including preventive and wellness benefits. We have plans that use national networks, but we are mostly known for our open access plans. These plans are going to offer the client freedom to go to any doctor or any facility. And with these plans, we're going to use reference-based pricing, which I'm going to go over. That's going to help reduce their out-of-pocket expenses while they're satisfying those out-of-pocket costs. Simplified underwriting. So that means that the client only has to be able to go through the application questions and answer a no to all the questions. We do not ask a tobacco use question, so there's going to be no rate ups if they do use tobacco. We accept controlled hypertension. We also accept controlled diabetes by diet and exercise only. So that means any type of oral or injectable or insulin would be a decline. No social security number is needed. So if your client is not a US citizen, they only have to be able to answer that they have resided in the US for the prior 4 months. And we do not require any proof. So it is going to be on an honor system. I've had agents ask how would they find out if they were now not in the United States for the prior 4 months. That would all come out through underwriting should they file a large claim. For our open access plans that have no networks, so of course with networks plans, you're going to have a link and you're going to look to see if a doctor is in that network that goes along with your plan. Well, with the open access plans, there is no link to look up providers. It's completely open access. So they can reach out, the client can reach out to Point Health. This is a patient advocacy service that we've partnered with. So clients on the open access plans can reach out to Point Health. It is free for them to use this service. So you want to make sure that they're aware of it and they utilize it. Point Health can help them navigate and find a provider or a facility in their area for the specific services that they need that'll work best with the plan. And Point Health also offers bill negotiation services. So that means that if they do have a large bill that they're responsible for, Point Health can help them negotiate down those bills or set up payment plans for them. And we are known, Pivot is known for developing products for certain niche markets. So student athletes, high school and college athletes are covered on the Pivot short-term plan. Some of our competitors exclude them. Child-only policies, as I mentioned, you can have a child as young as 6 months of age on a policy by themselves. Or if you're putting multiple children on a policy by themselves, the youngest cannot be under the age of 6 months. Now, if you have a baby under the age of 6 months, you would be able to have them covered, but they would have to be on the plan with an adult. And our largest market segment still till today is that pre-Medicare market. That 60 to 64 and 11 months of age is our largest market segment. Again, because the pricing on the short-term medical plans versus an ACA plan for that age band is much more competitive. And all of our plans are including free and unlimited telemedicine, including dermatology consultations. So you want to make sure that you remind your client that if they're trying to stay price conscious and they select a plan that does not offer office visit copays for those sick visits, they always have access to that free and unlimited telemedicine with their plan. And as I mentioned, we have two carriers that insure our short-term medical plans. Both are A-rated carriers.
Letty,
Yes.
can you go back to your prior slide?
Yep.
I just wanted to reiterate a couple of points that I
Yes.
think are really important for people that are new to selling the pivot products.
Mm-hmm.
It's really important to try to lock in the extended duration. So if you're in a state that has the 2 and 3 year durations, you're locking in their insurability for those periods. So with the potential change, in short-term medical durations that may happen legislatively later this year, if your client is in one of those 3x364 plans, they can stay in it because all of those will be grandfathered in if the rules change. So it's really important if your client may be looking for, an indeterminate length of coverage, lock them in for the longest term, because on those companion, you're locking in the rate as well for up to almost 3 years. So huge selling point to try to lock your clients in. And remember, your commissions are level. So for the entire 3 years, basically, you're going to get, your full commission amount. And then the other thing I just wanted to mention, oh yeah, that was it. Just really the lock-in of the premiums. But I think those are huge selling points. And I don't know if there's any competitors that have locked in premiums for 3 years. Do you?
Mm-hmm.
But anyway,
Yeah.
thanks. I just wanted to mention that.
Yep. And also keep in mind too, just to piggyback on what Lynn is sharing, make sure that your client understands as well. Don't have them feel intimidated. Say they enroll for the 3x364. These plans can be canceled at any time. So should their situation change, should they maybe get a job that will offers them group or employer coverage, they can cancel these plans. So it's not like they are committed and have to pay out all 3 years if they no longer need the coverage. So there's that flexibility. So these are the 4 types of categories of short-term medical plans that we offer. We have a core plan. These are what we call our light short-term medical plan, because there are some limitations, and I'm going to go over those, and I want to make sure that you are clear on those limitations, so that you're sure to make sure that your client understands what they're purchasing. Those core plans are also known as a passive PPO. So we're giving the client access to utilize a First Health Network provider, but the benefits are not different if they go outside of that network. Hence why we call it a passive PPO plan. Classic plans are going to be all open access plans, no networks whatsoever to be offered or to utilize. They're going to be complete open access plans. And you're going to see when you go into your quoting portal that the classic plans give you the largest array of plan options to pick from. And when I say options, I mean changing the benefits within each plan name. Epic plans, you're going to have 2 categories with the Epic plans. One is going to be an open access plan with no network restrictions. And then you're going to have an Epic plan that has a network, and it's a Cigna network that it utilizes. In some states, you'll have both plan options offered. In some, you may only have one. Then we have our quantum plans. This is our true PPO plan. It also utilizes that Cigna network. But of course, these are true PPOs, so that means if they go out of network, they will lose benefits. And these plans, unfortunately, are not going to be available in states like Texas or Georgia. And I mentioned those states because those are two of our top selling states. So, core plans. Great for those everyday type of expenses. They are priced very reasonably. As you see here, there's two plan designs with the core. There's going to be a core 1000, core 2000. That's actually their deductible for each of the plans. Uh, Maximum benefit on these plans are going to be $750,000. The core 1000 is going to offer a discount card for prescriptions. The core 2000 offers prescription coverage with copays, no RX deductible to be satisfied. But just so you understand, any of the plans that you choose that have RX copays are going to max out based on the duration of the plan. So these benefits are separate from the plan deductible and coinsurance. So these plans have no RX deductible, but if the client is on a plan up to 6 months in duration, the RX benefits are going to max out at $1,000. If the plan is from 6 months up to a year or 364 days of coverage, the benefits will max out at $2,000. So, of course, that is not an accumulation of the co-pays that the client pays. That is the dollar amount that the company lays out for those medications. Now, keep in mind that when we're talking about those extended durations, when I mentioned that all benefits reset for each new coverage period because it is considered a new policy, even though they're not applying again, those RX benefits also reset with the new coverage periods. The core plans offer office visit copays, $30 for a primary doctor, $60 for an urgent care or a specialty doctor. And these, please take note, are for sick visits only. These are not for routine or wellness checkups. And it is limited to 3 visits per insured per coverage period. Now, when it comes to the hospitalization benefits, this is the key thing that I wanted to make sure everyone was clear on. The core plans are the only short-term medical plans that we offer that have some limitations on the hospitalization benefits. So this is a screenshot of the brochure, and the dollar amounts that you're seeing here is not the maximum that the client would be responsible for. It is the maximum amount that the plan will cover. So for example, if the client were confined to a hospital, the plan will cover up to $1,000 per day. That includes room and board, nursing services, miscellaneous charges. So even after they've satisfied deductible and coinsurance, the max benefit is only going to be $1,000 per day. So anything billed over that dollar amount is considered not covered by the plan. For this reason, these plans are more common with the younger age band. So under the age of 30, child or children only policies, because the likelihood of needing those hospitalization benefits are going to be much less. Now, we also have agents that will sell it to the older age band. But of course, then it's wise to stack it with a indemnity or a fixed benefit plan that'll give them some additional coverage for that out-of-pocket exposure. Both of the plans do include one wellness or preventive benefit that's going to cover up to $200 towards that one wellness or preventive. Now, keep in mind that is towards a primary doctor, like a routine physical. It does not include um, child wellness or routine visits that a child may go through, especially in the younger years where they go a couple of times a year. That is going to be a separate benefit. That routine or that preventive benefit is not going to be applied to that, as well as for a female's routine annual OBG exam. That is not does not fall under that preventive wellness benefit. That is a separate benefit subject to deductible and coinsurance. So just want to make sure everyone is clear on those, because I have had agents call in and say, well, my client uses her OBG as her annual, her routine. That's her primary doctor. Unfortunately, it just falls under a separate category when those claims come in. These are the classic plans. So under the classic category, you have economy, choice, standard, deluxe. With these plans, they're going to be all open access. And I apologize, I don't know if I mentioned with the core plans, they are underwritten by Companion Life Insurance Company. So if you are offering the core plan to a client and an extended duration, the rates would be locked in because it's one of the products underwritten by Companion Life Insurance Company. The classic plans are all underwritten by Companion Life Insurance Company as well. I mentioned that you're going to have a lot of different benefit options with these plans. So you see that you're going to have choices on deductibles ranging from $1,000 up to $10,000, max coverages ranging from $100,000 up to $1 million. If the client is looking for a plan with those office visit copays, like I described, you would want to offer them the choice plan or the deluxe plan. Those are the only two that include those sick office visit copays. All of the plans do include the one wellness or preventive visit, like I just described with the core. That physical exam, it'll cover up to $200. If the client is looking for a plan with prescription coverage with those copays, like I described earlier, with no deductibles, you would want to offer them a standard or a deluxe plan. So these plans are very rich in benefits. And again, these are screenshots of the brochures. So you can see these in your agent portal. The Epic plans. Epic plans are the only plans underwritten by North River Insurance Company. That is an affiliate of Crum and Forster. These plans are the ones I mentioned, have two different plan designs. So the Epic PPO utilizes a Cigna network. The Epic Base is open access, no network restrictions whatsoever. These plans have become very popular because they are 100% coinsurance plan. So what do I mean by that? Once the client has satisfied their deductible that they selected, that would their out of pocket would be satisfied. There is no coinsurance to satisfy before the plan kicks in at 100% for covered services. Maximum coverages on these plans are going to be either a 500,000 or $1 million. And with these plans, both of them are going to offer one wellness or preventive visit. Again, that routine or physical, that it is going to cover $100 towards that visit. And there is going to be a 3-month waiting period when it comes to the Epic plans, where the Classic and the Core plans do not have a waiting period to utilize that benefit. Couple of different features with the Epic plans. You'll notice that when you go to run a quote for a client, there is going to be a supplemental accident rider that can be selected at the time of enrollment. And it's going to be either a $5,000 or a $10,000 benefit that is going to cover expenses incurred if the client is injured in a covered accident and requires medical attention within 72 hours of the accident. Just keep in mind, they have to select it at the time of enrollment. It cannot be added once the application has been submitted. Also, if they did not want that coverage, we cannot remove it. So you want to make sure that it is not checked off when they enroll. If not, you would have to cancel that policy and rewrite them. Also, when it comes to the prescription coverage with the Epic plans, you would have to make sure that they select the option that includes the RX coverage with copays. So wherever you see Epic being offered, you'll always see the plan being offered twice. So the first option does not have the RX coverage with the copays, second option will include it. And I'm going to show you what it looks like. I did a screenshot of an Epic plan. And again, those RX copays, the benefits are going to max out just like I described earlier based on the duration of the plan. And just a reminder, Epic PPO, if they choose that plan, you want to make sure that they understand that in order to maximize the benefits, they need to stay in network whenever possible. And the Epic Base complete open access has nothing to do with the Cigna network. They can go to any doctor, any facility, and we use the reference-based pricing. So let's go over reference-based pricing for those of you who are not familiar with that. So any of the open access plans that do not have networks tied to them, essentially what it means is that Pivot is going to allow based on Medicare allowable or usual and customary for covered services. So we're going to pay up to 125% of Medicare allowable or usual and customary. For a facility, we're going to pay up to 150% of Medicare allowable. Now, this is not a reimbursement plan, so your client does not have to pay up front and then wait to get reimbursed for the claims. They present their ID card at the time of service. The information is on the card for the provider or facility to file the claim with us. We do the discounting, and on average, we're seeing about a 69% savings for the client. The EOB that they get will also show what was charged, the discount amount that was taken, and what the patient responsibility is. Keep in mind that this comes with balance bill protection. So that means that if the client should receive a balance bill from that provider or the facility due to the discount that we took, they have the right to send that bill into us. We're going to settle out that bill for them. They would not be responsible for it. And just so you know, about 96 to 98% of our claims are filed through this reference-based pricing. It really does work. And I've seen the balance billing come through and being settled out on behalf of the clients. So you want to make sure that your client understands while they're meeting their deductibles and coinsurance, depending on what plan they're on. If they're on an open access plan, yes, there's going to be out-of-pocket expenses, but with the reference-based pricing, we are going to be offering them discounts on those covered services. So it does benefit them to have these plans in force. Then with these open access plans, again, they have access to that patient advocacy service, Point Health. So make sure that they know they have that service. It costs them nothing to use it. Let Point Health help them find providers or facilities, and also with the bill negotiation services, free of charge. You're also going to notice that the open access plans, when you're in the quoting portal, tend to be much more competitively priced because there's no provider access fee being charged, which is charged with the PPO plans. And we pass those charges on to the client in their monthly premium. Then we have the PPO network, that Cigna network on that Epic PPO plan, and the Quantum plan that I'm going to go over that I mentioned earlier. Then we have that First Health network, again on the core plan, but only as a passive PPO. So it's an option. They can use the First Health network provider. If not, those claims are going to be treated like an open access plan, and we're going to use the reference-based pricing. The Quantum plans are the last plan design, and they are also underwritten by Companion Life Insurance Company. You're going to have two plan designs. It's the Quantum PPO high deductible or the Quantum PPO copay plan. These plans have a max out of pocket of $10,000, which does include the plan deductible. Your max coverages is going to be $500,000 or $1 million. The PPO copay plan is going to include those 3 office visit copays for those sick visits. Both of the plan designs are going to include that preventive or wellness examination, and it's going to cover up to $250 towards that visit. With the Quantum PPO copay plan, they're also going to get prescription coverage with the copays and no RX deductible. These plans are very rich in benefits. It does include a supplemental accident benefit. So it is not a rider like on the Epic plan that needs to be added on at the time of enrollment. It's included in the Quantum plans, and it essentially will cover the plan deductible for any expenses incurred if the client is injured in a covered accident and requires medical attention within 72 hours. The ancillary products, as I mentioned, the Brilliant Dental, it is underwritten by Renaissance. It's a PPO plan. You're going to have 3 plan designs to choose from. The value plan is basic coverage only. It does not include any major services. And there is going to be a 6-month waiting period to use those basic service benefits. With the essential and maximum plans, they do include major services. There are no waiting periods for any of the services on those plans. Those 2 plans are also progressive, so the benefits increase from year 1 to year 3 and then stay level. If you are including children on a dental plan with an adult under the age of, children under the age of 18 being included with an adult, you may want to offer them the maximum plan. That is the only plan that includes the child ortho benefits. And again, the dental has no maximum age, so you can sell this to Medicare clients and they can keep these plans until they're 100 years old if they choose to. You'll also notice that you are able to add on a vision coverage. It is through Vision Care. It's only going to be one option, and the vision is not available if they're not purchasing the dental. It's only an add-on when buying the dental coverage. The Latitude plan is that supplemental plan that I mentioned. It's a bundled product. It's an accident, critical illness, hospital indemnity, and accidental death and dismemberment plan. There's going to be 2 plan designs. One is a select plan with a $2,500 benefit. The preferred plan has a $5,000 benefit. The benefits are paid directly to the client so they can use that money however they see fit. And also, there is going to be no coordination of benefits. So these plans are going to pay out regardless if another coverage paid those claims. They also get some non-insurance benefits because this is offered, Latitude Plan is offered through Communicating for America. This is an association. So you'll see that they do have some other discounts and benefits included because their premium is technically their membership dues. And the Latitude plan, it can only be sold when selling a short-term medical plan. But if the short-term medical plan expires and the client has not turned 65, they can keep that Latitude plan and they'll continue to pay that monthly premium until they turn 65. And you'll notice that all of our plans, when you add on the supplementals or ancillary products, are charged separately because they are separate policies. So once you've gotten contracted, you get your pivot number or your writing or your agent number or your user ID. You're going to go to www.pivothealth.com. This is going to be the landing page. You're going to select for agents up here. Then you're going to it'll take you to the next page. You're going to go to already an appointed agent with Pivot. You click on the login. You'll register there for your agent portal using your writing number. And this is going to be your landing page. You have a state availability chart down here. You can open that up. You can see what products are available by state. We also have the duration chart in there that'll let you know what the longest duration is going to be offered. And there are some states that have some kooky rules when it comes to durations on short term. That's included in there as well. Now, you don't have to memorize this. You don't have to refer to it. You can just start a quote. As soon as you put in the zip code, the site will let you know whether or not there are plans available there. And it also allows the site to only display the durations available by zip code. The product portfolio tab, if you click on the down arrow, you're going to see all the product brochures that I've gone over today by category. Helpful Links has some good marketing materials in it. And then my book of business is going to keep a listing of all your pivot sales. As soon as you submit business, they'll be available there almost immediately. Go to get a quote. The next page, of course, you're always going to start with a zip code. Date of birth is required. Gender, first name, email address can be left blank. It is not required. I would recommend you leave it blank. Of course, if you're adding a spouse or children, you want to do that on this page. When it comes to desired start date, when you open up your portal to start a quote, it's always going to default to the next day. So if I opened up my portal right now, it would be displaying in this box 2/20/2024. The calendar on the right-hand side allows you to select a date as far out as 60 days if your client is looking for coverage for a later start date. Do make sure the client understands whether their policy is starting tomorrow or out to 60 days out from today. They are going to get charged for their first 30 days of coverage upon submitting the application. Once the policy's in force, then their draft date will be on their effective date each month going forward. They can call in once the policy's in force and change the draft date if it doesn't work for them. When it comes to the durations, what's displaying on this first page is only a single term duration. It is not the extended durations, and the site will always default to the longest option that you can offer in the state, again, by single duration. So I have a Florida zip code in here. Click on Find Plans. Next page is going to display 3 recommended plans. Keep in mind, these are not your only options. It's just recommended plans based on the demographics that were entered on the prior page. As you see here, these have the extended duration up here at the top right-hand corner based on the type of plan. So you have the companion life plans. North River limits the extended durations in Florida to 2 by 364 day. If you want to use filters, you can click on Show Filters to start narrowing down some of the plan options that are displayed, or you can simply just scroll down the page and view all the plans that are available. Now, again, this is going to not have the extended durations unless you open it up. On these plans, these are the tabs that I was talking about where you can make changes to the benefits that you're looking for the client. If the client is asking for a couple of options so that they can make an educated decision, you can select up to 3 plans by clicking on Add to Compare, and it'll allow you to collect 3 plans. It'll show them side by side, and then you'll be able to email that to the client. In that email, they can view details, they can view the brochure, or they can actually start the application process. Because you emailed it from your portal, you will be the agent of record even if they don't contact you, and you would get a copy. And when you email quotes from your site, you get a copy of the quote that you sent out to the client in your inbox. And then if you get a confirmation email that they enrolled, you would see that policy almost immediately in your book of business. If I click on View Details here to go to the next page, kind of just wanted to give you an idea what it looks like when you open up these tabs. So here I've opened up the duration box, changed it to the 2 by 364 day, and then you see how the ancillary products display below. It gives a little description on each one. If I click on these additional benefits and go to the next page, this is what it's going to look like. As you see, the premium increase because it's adding on what the monthly costs of the ancillary products are going to be. With this example, I selected the Epic base plan, and I chose the plan that includes the RX. So you'll see here prescription drugs with copays, just so that you have an idea what it looks like. When you click on view details from this page, then you would see the option to add on that supplemental accident rider. That's only going to be available with Epic plans. There is an Epic base plan available in the state of Pennsylvania. It is a state-specific product, so you want to make sure you reference the state-specific brochure, and that supplemental accident rider is not going to be available. So just a couple of different tips here. You see I've checked the additional products. Here it's going to give you the breakdown of the premiums. And I did make a mistake here, and I copied Latitude twice. But I did mention that all the premiums are separated out because they are going to be charged separately. If you wanted to share this quote with a client, you can email it from here. They would then see the short-term Epic plan plus the Latitude plus the dental that you sent them. And again, you're going to get a copy of that. Once they start the application process, if there's about 5 to 7 application questions, depending on the state that they're enrolling in, and they have to be able to answer no to all the questions. If they click yes on any question, it'll stop immediately at that point and it will not let them move forward. So just keep in mind, we do not have a height and weight chart. The only limitations are going to be weight. So a male cannot be over 300 pounds. A female cannot be over 250 pounds. We're not going to ask a tobacco use question. And again, we also do not ask for a social security number. They would only have to be able to answer that they've resided in the US for the prior 4 months. Once they go through the application questions with a no on all the questions, it'll take them to the contact information page. Here, their email address is going to be required. All communications is going to be via email. We do not mail out any policy documents or ID cards. Once they enroll, they'll get an email with instructions how to log into their member portal. And we also have a mobile app that they can open up and have their ID card available to them. Payment methods are going to be credit card or an ACH. Whatever method of payment is that's used during the enrollment process, that's what we're going to continue to charge them each month going forward. If this client was enrolling in a plan up to 6 months of coverage, they would have had an opportunity here at the bottom of this page to have enrolled in a prepay option, which means they were going to prepay for their 6 months of coverage up front. They get about a 25% savings off of their premium. And keep in mind, after the first 30 days of coverage, if they had to cancel at month 3 or month 4, they would be eligible for a refund for any unused premiums, providing they didn't have any outstanding claims on the policy. And unfortunately, there is no prepay option on a 364-day plan. So once they complete this, they would just sign off on the disclosures, and they do have a 10-day free look. So they enroll, the policy starts. If they decide to cancel for any reason within the first 10 days, they would get a full refund, including their enrollment fee. It's a click to sign. There's nowhere to email this part of the application only for a signature. You would have to create the quote, email it to them, and let them go through the enrollment process. Just a side note, in the state of Pennsylvania, agent-assisted applications are not allowed. So you do have to create the quote and email it to them. In other states, providing that the client is good with you putting in the application for them and providing you all their payment information, that's between you and the client. It's a click to sign. It is an electronic signature only. And then, of course, they get a welcome email. and you get a confirmation email that they have enrolled in the coverage. Very easy process. Of course, I dragged it out going over some of the highlights, but just want to make sure that you were familiar and kind of have an idea what to expect when you go into a quote. And I always recommend that you go ahead, run a quote, go through the application questions. Nothing is going to happen until you put in a payment method. So I want you to feel comfortable with it. Here's my contact information. I want to make sure that everyone knows that I'm here to support you when it comes to your pivot sales. Don't Any question is a good question.
Thank you so much, Letty. The only thing I want to add to that too is it's really nice after you've enrolled your client or they've self-enrolled, they're going to get an immediate email with links to set up their member account, how to get their ID card, and how to use the plan. It's really great because that email is also CC'd to you. So you can see that your client has self-enrolled. You've got a copy of all the information. They're already in your portal. You can send them a temp ID if they need it. So just, really consumer-friendly process here. But Letty, great job. And I just want to
Thank you.
again say that Letty is a wonderful resource for us. So if you do have a deep dive question about product, she is really quick in getting back to you. So make sure that you save her email address and her phone number if you need help with any of your pivot sales. Does anyone have any
Absolutely.
questions? Okay, I guess you answered everybody's questions, Letty.
Great. Well, thank you so much, everyone. I look forward to working with you.
Thanks, everyone. Have a great day.
Bye-bye.